Hello, everybody. We are here in the direct today. Hello, the people who are here in direct. And the people who come later. I come later. We have a lot of people who we can. We see the presentation. Okay. Oh, let me start my video camera. Hello, everybody. With the people waiting there. You can in Facebook. I don't know if you have chat. But you can have a chat in uh, in in YouTube. If you go to YouTube, there's a direct chat. I will try to answer in my time the questions. Okay, but I am not sure I can do the answers now. All right, but in the comment in our channel, normally I will obviously um, answer the question. All right. Hello, everybody. Here we talk about TMJs. TMJs is a very important topic. A lot of people ask to do podcasts and webinars regarding TMJ. TMJ is a particular job. We know everywhere, but the job pattern. Always I say the same. TMJ is not just a job. eh, It is a joint and the craniofacial system connected with the posture. Today, I prepare for all of you something regarding function and dysfunction of TNJ. I will show some patients also that the people who have problems in the TNJs and why, how the occlusion is connecting on it. But I want to clarify something. It is just not the occlusion. Occlusion is something, dental occlusion, I'm talking with the teeth touched together, who block the jaw in the wrong position. And if the jaw is blocked in the wrong position, obviously we have a problem in the TMG. Okay, I prepared today a PowerPoint just displaying that. And the thing I want to always say that TMJs we cannot treat it. TMJs will not. TMJs is regarding posture, regarding craniofacial system, regarding interdisciplinary protocol, etc. I will do some podcasts in English regarding therapy because a lot of people tell me, please explain what your school. We are international school. And I am for the people who know me. I am Professor Roca. I am the director of the NPR International School. Our school is particular school that teach for every professionals of medical sciences all around the world, America, Europe, and Asia. Teach medical doctors, dentists, physiotherapists, osteopaths, and the concept of rehabilitation. And we said in our school, it is very, very, very difficult to treat the TMJs just locally. That's why I said today functional dysfunction, because function is related with the temporomandibular joint, but also with the posture. Right? Uh, Something I want to clarify for all of you is don't see TMJs only as a joint, as a, even in treatment, in diagnosis and treatment, the joint part of a craniofacial system connected with the rest of the body. That's the point. All right. Okay, I don't want to stay here more talking about different things. We go directly to the presentation. And remember, I will do different podcasts in our channel. If you are not registered in our channel, do it because you will receive all the things we do in direct and not. But we have a lot of videos, more than 650 videos, different topics, different languages. It's free chat. And if you like it, please register. subscribe in our channel, click the bell, as the YouTuber said. I am the YouTuber. I am a professor, university professor. If you want to see the channel, subscribe, click the bell, and if you like the video, do a like because doing the like, YouTube will share for everybody. And if you like it, share the video because this information is free just for patients and also to clarify something for professionals. And we will not talk only for dentists. We will talk for physiotherapists, osteopaths, medical doctors, etc., etc. Different languages. This is English. Okay, to talk. Right. We starting in our presentation. Uh, we said function and dysfunction. Function and dysfunction. I hope the voice is good. I hope you listen well. I hope that the voice is coming good for all of you. We said function and dysfunction. Look at that. Very important topic to start in T.M.J. And we will go ahead on it. Let me clarify my voice because teaching online, I teach every day. I talk a lot with my students all around the world, and my voice is saying, Silverio, please leave something relaxed to me. Yeah, yes, my voice is very tired. Okay. All right. And then we're going ahead. And I will share just the power. Right. Today talking is about TMJs, temporomandibular dysfunction. NPR, it is rehabilitation for all medical sciences. We're going ahead now in the talk. We say tips of TMJs, temporomandibular joint, and also temporomandibular disorders. What is the dysfunction of the TMJs? How it is produced? The connection between the rest of the body, local and general causes, local and general symptoms, treatment. We have a lot of things to talk. A lot of things to talk. But today we will focus in something regarding the what is dysfunction. That is important. What is the dysfunction? How is functioning the TMJ? And we see some patients. All right. First thing for all of you, the joint is not a disease. Joint is a joint, part of the craniofacial system. It is part of the craniofacial system. That's very important to understand. Why I'm saying that? Why? If you focus on it, the T base is part of the craniofacial system. And the craniofacial system is connected with the rest of the body. First thing to pay attention. Most of the T.M.J's problems, they are dysfunctions. What I mean that, what I'm saying to that. Most of them is dysfunction. And if you treat it early, you finish the problem. If you leave it chronically, you will create a dysmorphisms, as you will see later in the page. I don't show you. Dysfunction, that's more important. More of them are dysfunctions associated to problem external to the joint. The real problems are tumors, arthrosis, uh, and local causes, but it's less. I can say 5% 10% of the problems of the joints are local causes, as tumors, arthrosis, etc. Most of them is dysfunctions who apply from outside the TMJs, and that's very important just for doctors and for patients. Go ahead. 5% is a real dysmorphisms. Mostly the causes are the increasing pressure into the TMJ. What do I mean? What do I mean? Listen, this is not a lecture. It's just a podcast. But if we increase the pressure, all the situations who increase the pressure inside the TMJ is creating dysfunction. Chronically, we create a big problem that is dysmorphisms. That's why to start early. I said during the growth, we are focused in child. During the growth, we start there doing a good function in the craniofacial system and in the posture we will have in the future. The TMJ disorder. When the mandibular joint is changing the position and this position is increasing, the pressure will have a decrease. Most of them are the vertical dimension loose. For the people or patient, this part of the face, when we lose the vertical dimension, we increase the pressure here. And most chaotic, if we have less vertical dimension and retroposition, big problem in the TJs. Retroposition, vertical dimension loss, condylar intrusion, increasing depression, those are main causes of TMD. What means? Please do not confuse TMD with TMJ. TMJ is the joint, TMD is temporal mandibular disorder. That means the disease. TMJ, as I told you before, is part of a system. We call that craniocervical mandibular postural system. Because this system, brain, face, neck, is creating chronically a lot of problem in the posture. That's why I am saying we cannot treat TMJ just with a bite. It's something locally. That is one part of the treatment, not the main treatment. If you understand the things I am telling you now, you will change your mind when you change the treatment in the TMJ. So that's very, very important to understand. We go ahead and then occlusion. That means what we say when we say occlusion. Yeah? Dental occlusion make the difference in the physiology. Why? Because this joint have the joint, posture of the joint, and who block it? The occlusion. More chaos if the occlusion is dysfunctional. Imagine dysfunction in the joint, dysfunction in the occlusion. Finish the health. The big difference is occlusion. If we have a good vertical dimension and a good occlusion, it will prevent the intra-articular pressure. That means health. That's the joint. The joint is very important to be centered. We need a joint in a good central position in the cavity. We call that central relationship. We need freedom of movement. I will do some podcast regarding occlusion, the functional occlusion. I will do something regarding postural, the neuromuscular postural vertical dimension. That's another important topic to do in the podcast. We have a lot of courses regarding that in our school. Know how to found the central relationship and the vertical dimension. Yes, and how to measure that. How to measure what is good for the posture. That is important. Central relationship and also the freedom of movement to protect the disc. To protect the disc. When the you know one normal thing is the click. I have a click. It's not the disease. Sorry about that. When we know, I will show you later a little video, just a very short animation. Mm, Click. When we open and close, we have the synchronization of the movement and the disc. We call that disc synchronization. For some reason, we can lose that and we have a click. I will show you that. That's important to understand. Click, it is not a temporomandibular disorder. It's a dysfunction. For some reason, I will do a video regarding the causes of the click. How if you leave it, you will create a problem inside the joint. Okay? And we see there, this is synchronization. Moving, open and close, and the disc is synchronized with the joint. No click here. For any reason, we can have this. No synchronization. It can be hyperactivity of the muscles. Also, it can be the laxity of the ligament, hyperactivity of the muscles, different things that create that. That is no synchronization, and there is a click. Chronically, if we leave it, the disc can lose the position. That's very dangerous for T.M.Js, that situation, and we will have a lock. What is a lock? Lock of T.M.Js is brain said, do not open and close because you will broken the disc. That's important to understand. This is normally physiology, no more than that. Okay, and I will go back and you will see the three positions. Okay, this is go in there. Look at the normal function. Click, block, and remember that picture. That's very important. This joint is resist traction physiology doesn't resist pressure. When we have increasing depression, we will have a disease inside the joint. And that's a very important picture, you see. Reception. Back in the joint is arriving all the life for the temporomandibular joints. If some situation in the jaw position is going to that back position, will be very dangerous for the joint. Do you know something? Central nervous system have a very bad impact for that. Bruxisms. Bruxisms is a very bad defense to protect this area here. And there we have the most important receptors of the TMJs. Very quick, not adaptation, receptor for pain, send the alarm, and the defensive bruxism, very bad defense, because chronically will create more problem in the temporal technology. And that is important function for the TNJs. Functionally, the TMJs is a liver of third grade. What we have here, the fulcrum, who is the joint that we have to protect. Here, the resistance, the occlusion. If occlusion is bad, it will increase the problem in the joint, in the fulcrum. And how is the forces? If you understand that picture, the level, you will understand that why when something happens here is creating problem, no more protection into the fulcrum with the joint. Okay. Okay, shortly, this is the thing I want to do for the presentation today. I don't want to go very longer than this, okay? And we see patients, some patient about this. That's important to see how the patient is going, how the patient, we can see the patients in our picture. Third patient is a chronic dysfunctional occlusal rehabilitation. What do I mean? We have a patient who for more, I don't do here the history of the patient, but just to show a patient who for more than 10 years have a very bad rehabilitation who create a lot of problems locally and post. First patient. The occlusion of the patient with a very, very bad rehabilitation is a chronic, I call that, why I call that dysfunctional rehabilitation? Because that rehabilitation have not functioned, no protection. This patient for many, many years go like this. That was created, that has created a temporomandibular disorder with postural alteration. When we have that situation, as I told you before, the main defense is bruxisms. Brain, central nervous system is thinking that is defending that and is creating more problem. That situation, this is the problem. Occlusion who do not protect. Going ahead. Bruxisms, abrasion. This creates a major problem through go from the facial system and the posture. And look at here. Temporomandibular joint arthritis, the chronic increase in pressure has caused the perforation of the disc. Chronic. That's very bad situation. A vicious cycle that never stop. Remember that. And also, it is creating, as you see there, the associated postural pathology with a big overload. As you see, local, chronic, post. Slowly, if we Do not treat early. And if we don't treat with an interdisciplinary protocol, we will arrive in that situation. Don't forget it. Overload. Patient 2, mandibular retroposition, no functional guides, anterior guides. Patient with a deep bite, retroposition, deep bite, and retroposition. No protection, functional guides, anterior guide, canine, speaker, occlusion. No protection. The dysfunctional occlusion can be observed, which always generate bruxisms, defensive bruxism, which transforms the situation into chronic condition. The face, great hyperactivity, buccinators, trapezius, all cranial muscles, and the X-rays. We can see in condylography the deformation of the glenoid cavity and the condyle. Chronic, we have this. Patient 3, side deviation, no functional gaps. Look at there. We have a patient with a lateral deviation, not a good functional occlusion. Defensive bruxism is always established, which worsens the situation and increases articular pressure. You see, if you see the picture of the temporomandibular disorder is the same. Dysfunctions, who is created here. There. Here, let me put my finger there. No, the other side. You see there the situation. Right? Okay. And now we're going ahead. And look at it's causing a block. That situation, you see the open and close is like an S, and the patient cannot open because it is a defense. Don't do the open because it's protecting the temporomandibular joint. And this is very, very important to understand. Very, very important to understand how the situation can arrive to a block, right, to a block. And that's important to understand. Just for finish today the podcast. I hope that you enjoy it. All the things that increase the pressure into the temporomandibular joint is creating a problem. The problem is not only locally, it's holistic problem, and the treatment and diagnosis can be holistic and for the whole body. And prevention is the goal. Starting to prevent in early age. If we start in boys, in childs, when they are growing, they will not arrive in the future. And remember, treatment it is not a bite. I am in a different groups of disorders, and they are asking question, what is the pie? This pie is better, upper or lower. This is better than the other. This is Botox is better. That's chaos. Botox is nothing. Botox is going to the muscle, no more. It's a very bad symptomatic treatment. If you focus in diagnosis, dentists, medical doctors, physiotherapists, osteopaths, if you focus in an interdisciplinary diagnosis, you will have an interdisciplinary treatment, and the patient will not suffer. And patient, pay attention. There is not magic therapy. There is not Botox. There is not bite. There is not nothing. It's important to start the diagnosis, to see what is the problem, what is the cause, go directly to there. And when you understand that, there is not only local, you can be the whole life treating a symptomatic treatment. Okay? No, symptomatic is not a treatment. Symptom is not a treatment. Okay, I hope you enjoyed the video. I hope you enjoyed the presentation. You enjoy our channel. Stay there. Anytime we do some presentation, some of them they see directly in our channel. Some of them will go later to see the, uh, the video in the future. Okay. Thank you so much to be there. Thank you so much to follow us. If you like the video, do a like. eh, Encourage me to see. I want to do more videos for all of you. And if you like it, subscribe the channel and you will receive the. If you click the bell, you will receive when we do presentation. Okay, pay attention on it. I will do a lot of presentation. Right. Thank you so much to be here. I see you in the next talk, in the next podcast. Bye bye, everybody. See you next in the next presentation in our channel. Bye bye, everybody.